Access to basic health care is a fundamental right of every citizen. This is pivotal to the overall well-being of individual families and the nation as a whole. On this episode of the program, we hope to answer the questions of access in the health sector in terms of adequacy. Now, have you ever heard of the wonder plant called Hospital Too Far? You do not want to miss this on our Nature's Corner. Many thanks for joining us. I am Salwa Khalil Ibrahim. With an ever-growing population, inadequate healthcare infrastructure and manpower have always been stumbling blocks to efficient service delivery in Nigeria's health sector. The economic realities in the country has also rubbed off on the cost of medications. Some blame these on the exchange rates. Government, however, says it is aware and committed to resuscitating the healthcare sector. So, what is the situation like now? Stay with us for answers. I'm now joined by Dr. Olusegun Akere. He is the Managing Director, Mass Life Healthcare Limited. He is also a trained physician and a health management expert. Many thanks for joining us, Doctor.
Thank you. Thanks for having me.
Okay. Now, give us a little insight into what the health sector looks like at the moment.
Okay. Thank you very, very much. In Nigeria today, just like you noted during your preamble, the more than 80% of Nigerians cannot be said to have adequate access to healthcare. Primary healthcare system is the cornerstone of any developed health system, and once that is that level of care is plagued by whatever issues, like the issues of funding, like the issues of inadequacy of human resources, the issues of governance structure, issues with availability or even absolute lack of medicines and other consumables to run the system, then we have the kind of situation that we have in the country today. There is this allocative disproportionalism in which we have a situation where more than as much as 70% of the resources, public resources in the health sector is focused more on tertiary and secondary levels of care, whereas in an ideal health system, you have upward of 60% of the resources being used or being targeted at the primary level of care. So these are some of the issues that we have that has stifled access to healthcare in Nigeria today. Okay.
Is this redeemable, like you mentioned? I know we have a lot of challenges, especially at the primary health care level.
Yeah, very, 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 very well. They are redeemable, and I'm aware that government, over time, up until this current government, is implementing strategies to direct attention to the primary level of healthcare in the country. Over the last decade, there have been various strategies that have aimed at coming up with 10,000 primary healthcare centers nationwide. The target is to put one functional primary healthcare center in every electoral ward in the country. Some of the issues that I mentioned earlier, the issues with funding, issues with governance, and the recent issues with brain drain. You know, many healthcare professionals trained in the country, leaving the country for greener pastures, have negatively impacted the implementation of the strategies or the outcomes of the strategies. But gains have been made, and we're having situations where moribund primary healthcare centers are being brought back to life. They are being refurbished, being re-equipped, and the human resource for healthcare, that is all the health care workers that are required at that level, are also being trained and being encouraged to serve at the level of the primary healthcare. Yes, the gain appears to be a bit slow, but we're making some inroads based on the activities that the National Primary Healthcare Development Agency, as well as their state counterparts, state primary healthcare development agencies, on the supply side of healthcare. And then, of course, the demand being created by the National Health Insurance Authority. On that side, too, there have been reforms. There was a review of the Act from 1999. In 2022, the then President Muhammadu Buhari signed into law the National Health Insurance Authority Act of 2022, which reviewed the participation in health insurance in Nigeria from voluntary to compulsory, which is a step that is required to further expand participation and increase the pool. So these are some of the strategies that have been over the last 1 to 2 decades that have been instituted to make better the situation in the health sector.
Okay. Now, let's talk about a little bit of facilities, infrastructure now, to be specific. We have a lot of primary healthcare centers scattered around the country. Almost every community has a primary healthcare center. Now, these structures are there, not necessarily the facilities or the equipment. What do you think are some of the issues, and how do you think we can get that right?
All right, thank you very much. Like you've noted rightly, in many cases, the infrastructure, that is the building for these designated for primary healthcare centers, are there in the communities. But over time, usually when they are built and they are equipped and everything is new, they look attractive and they're actually functional. But within a year or two, you begin to see a deterioration in the state and even in the capacity of these health centers to provide the services that they could provide at the beginning. So once the eyes, so to speak, are taken off them and to move into other areas, then issues with compliance become the real issue so healthcare providers are not encouraged to remain in these health centers. Some of them, it's due to the fact that they are not well paid for the services that they are providing. The issues with governance of those facilities, once equipments and other resources like medicines and other consumables run out, they are not replenished. And so you find a situation where healthcare providers just come in, they sit all day, they sit all week. Even when people come with their health challenges, members of the community, these health providers are unable to help them in any way because there are simply no resources with which they are going to be able to help them, no drugs and no equipment. So you just see things just generally go down and the facilities run out of operations and the infrastructure themselves become dilapidated. So that's kind of how things have been over the decades. And that's what the National Primary Healthcare Development Agency and the state counterparts are now working to ensure that this kind of cycle is broken, and then we can have thriving primary healthcare centers and a thriving primary healthcare system in the country. I should also mention that one of the reforms in the health sector is the Basic Healthcare Provision Fund. And there are two aspects to this fund in terms of its operations. There's about 50% of this fund that is channeled to the Primary Healthcare Development Agency to take care of the supply side, to ensure that these facilities are built, equipped, staffed, and there's a viable drug and consumables revolving fund that will keep these facilities alive and running, providing the services that they should provide to the community members. And to also see to it that the community takes ownership of these facilities, which is something that has been missing. These facilities are essentially seen as government facilities, and so it's only when government comes to undertake oversight that anything happens. That's to change. So the members of the community are to now take ownership, provide leadership, and have those who are running these facilities to be accountable to members of the community. So these are some of the reforms that are currently being undertaken in the health sector, which we believe are moving the sector in the right direction. Okay,
now, Doctor, we'll take a breather here. When we return, we'll speak about some of the solutions towards access to health for all. Join us again. Many thanks for being there. Now, Doctor, in the last 1 year, we've seen priority given to the health sector and a lot of policies. Now, what is your opinion towards that, some of the policies in the healthcare sector in recent times?
Oh, thank you very much. The policies are definitely not only well-intentioned, they are necessary. I mean, as they say, you can do things the same way and expect to get different results.
Certainly.
So we definitely must keep looking at the sector. We must be putting heads together to see how we can move forward. And we must also bring lessons learned from other climes to bear, in how we're going to move forward from where we are. So the reforms and policies are necessary. They are a good way forward. However, the implementation of these policies is then becomes the next issue. One crucial factor to the implementation of reforms will be the issue of availability of funds to be able to carry out whatever those recommendations in these reforms.
Okay. Now, beyond the issue of funding now, and I know you're an expert and not just a professional in this field now, what is your general overview now on a final note and advice towards access to health for all, despite the challenges? How can we get it right?
Access in health refers to ensuring, first of all, that there is no financial barrier. People who need healthcare can actually walk into the health facilities around them and not be worried about how they are going to meet their financial requirements that they need to meet to be able to access the healthcare. Access can also be geographical. If a pregnant woman, for example, needs to have antenatal care, she's not sick, but she needs to have antenatal care. But whether or not she's going to have antenatal care depends on how close to her the facility is. If the facility is far away and she needs to travel very huge distances to get there, she probably will not, and will want to save her resources for other things like maybe feeding the family. So there can be, these are all the issues that, that can confront access. However, the solution has to be along those lines. I've talked a lot about the issue of availability of funds. The funds in the health sector has to be as public as possible. Then this effort to put primary healthcare centers as close as possible to the people has to continue. And then there has to be adequate staffing for all of these health centers. There has to be the community health extension workers, nurses, and maybe even doctors. So that has to be there. There has to also be an effective drug revolving and consumables revolving scheme, such that the facilities, when they run out, in fact, they don't even run out of drugs. Before the drugs run out, they have a system in place to replenish their stock. So, because once people come in and they don't have, they can't get drugs, they can't get help that will actually solve their problems, they are not going to come back. And then they, if need be, they will have to travel very far, or they will look for other solutions. So these are some of this. These are some of the interventions that I believe need to be put in the health sector to make things better than where we are right now.
Very much appreciated, Doctor, for coming to Health Options.
Thank you very much for having me.
Okay, we've been speaking about access to public health in Nigeria with Dr. Olusegun Akere. Now, nature, they say, is the best medicine. Little wonder the Creator gave us a whole hospital in a plant. You're wondering what plant that is? Let's move to our Nature's Corner to learn about it.